This year's Davos annual meeting marks the world's leaders' biggest post-pandemic gathering. It was 3 years ago when, in January 2020, the World Health Organization declared a public health emergency of international concern. And despite many efforts to learn from the pandemic during these 3 years, and some of the world leaders declaring the end of it, it still represents a big risk and surely does not seem like it is over. During this session, we will evaluate the state of the pandemic, the increase in cases globally, as well as the consequences and impact on the healthcare system worldwide. It's my great honor to introduce the speakers of the session. Here with me we have Maria Lipton, President, European Research Council, Seth Berkley, Chief Executive Officer, Gavi, the Vaccine Alliance, Stefan Bancel, Chief Executive Officer at Moderna, and Michelle Williams, the Dean of the Faculty, Harvard Chan School of Public Health. My name is Sasha Vakulina. I'm with Euronews, and I'm going to be moderating this session. Michelle, I would like to start with you, please. Let's set the scene here, and let's try to evaluate the current state of the pandemic globally and the risks of these rather premature claims that the pandemic is over.
You know, advances in therapeutics and vaccines have really allowed us to reopen our society. And I think part of the enthusiasm comes from the fact that we are able to have gatherings like this again after a long period of disruption. So setting the context, we still in the United States have 526 deaths per year from per day from COVID. And that's up since October, where we were in the 400s. Now, what's really disappointing is 9 out of 10 of those deaths could be averted if we took our vaccines and boosters and practiced the other behavioral aspects, ventilation, mask wearing when appropriate, distance, and so on. And so for me as a public health person, knowing that we could avert 9 out of 10 of those deaths reminds me of the fact that we have to avoid prematurely talking about this pandemic being over. I also think that the context, when we talk about context, we must also discuss the more chronic implications of this pandemic. We must discuss the fact that there's, in the US alone, over 174,000 COVID infants will have a life course that's impacted by this pandemic. We also have to consider the fact that long COVID is a reality. And it's not only going to be impacting individuals and families, but the economic impact of long COVID, as quantified by Larry Summers and David Cutler, both of Harvard, is that it's going to cost us $3.7 trillion. Our healthcare system is still under stress. And what I hope people will understand is the vaccine not only protects individuals from transmission and severity, but it protects our health systems. We're able to have a functional or almost functional health system because we don't have the kinds of severe disease that we were facing in 2020. And we need to also recognize that our health systems have to recover as well. We have burnout from our healthcare workers, and we have case mixes of chronic diseases that are worse now and require more intensive medical intervention than before.
Let's assess the results of the COVID-19 vaccine delivery partnership, because this is the initiative from Gavi, the Vaccine Alliance, UNICEF, the World Health Organization, to support and accelerate vaccine delivery in low and middle income countries. This is such an important issue. Let's try to see where we are there with this program. For Seth.
Let me start. First of all, it's great to be back in person. 3 years ago, we sat here in Davos, and we didn't know where this was going to go. There were some political leaders saying, you know, it's going nowhere. But Stefan was part of the conversation, and Richard Hatchett and I sat down and said, the last pandemic with flu the developing world got no vaccines. They were all bought up by wealthy countries. So we knew that was what was going to happen if this turned into a global pandemic. And so we started this concept of COVAX, which we brought lots of other people into. And the idea was to try to solve that problem. First of all, the science was amazing. I'm sure Stefan will talk about that. 327 days. If you had asked us, we had thought maybe we could get there 18 months, 2 years. So extraordinary, advancements in the science. But on the policy side as well, we did our first dose in the developing world 39 days after the first dose was done in a wealthy country. Of course, it should be the same day, but that's, a record. And what we were able to do then was to bring doses to the developing world. Now, it wasn't smooth. It didn't go well. But in the first year, we had put a goal together of 950 million doses, because that's what we thought we could get for low and lower middle income countries. And we ended up with about 930 million doses. So we came close to that, and we intensified a program, both providing finance and technical assistance. And today there are 7 countries with less than 10% coverage. And as you can imagine, 6 of those are quite fragile countries with fragile health systems. The problem we have right now is since the beginning of 2022, we've had enough vaccines to provide whatever countries want. The challenge has been getting the demand. Part of it is the world says, we're done with COVID. Of course, the virus is not done with us, as Michelle said. And what we really need to do is make sure that policymakers understand that, we're continuing to see new variants, and we've been lucky that we haven't had one with very severe disease or one that can escape existing immunity. But there's no reason to think that that may not happen. So the best thing we can do is use the preventive methods, but also make sure we vaccinate our high-risk populations so they're protected against severe disease and death.
I'm going to go with Stefan Bancel. Let's talk about vaccine development, because we've heard how it happened, obviously, with COVID-19 starting from 2022, and how extraordinary the process was also in terms of the speed. How is development, adoption, and scaling of vaccine going on when it comes for different variants and subvariants?
And so where we are now is, we have plants in the US and in Switzerland. We've shown this summer that we're able to adapt to variants very quickly. If you think about it, in the US, Peter Marks told us on June 28th, we want for the US a BA.5 Omicron booster. And by early September on Labor Day weekend, he was in US pharmacies, which kind of 60 days, which kind of, in the old world of vaccines, would have been
5 years.
Easily.
Unthinkable. So we keep on working on technologies to improve that. The other piece that we are working on also, because Seth and I had many discussions over the last 3 years, as you can imagine, is how do we build manufacturing capacity around the world. We had a lot of export restriction during the pandemic, which was really painful for a lot of obvious reasons, even from countries who say we will not limit exports. Trust me, they were. And so we're very excited now that we are building a factory in Canada. We already broke ground in the fall. We're building a factory in Australia. We are going to start a factory this quarter in the UK. And we're also going to start building a factory in Kenya. We're talking to a couple more countries, because I would really like on every continent to have mRNA capacity. Because the amazing thing about mRNA is you can use the same facility, the same plant, the same machines to make any vaccine you want.
Maria, I want to bring it to a little bit of a different aspect with you here, because COVID-19 pandemic illustrated also the difficulties and the risks of science denial. And 3 years into it, we're still having lots of that. And this is such an important issue here, the highlighted importance of science. And I know you're passionate about that. How do you see the situation now? Has it improved or not?
I wish it had improved. I am passionate about science, and it's an interesting question. Perhaps interestingly, 2 of the countries which were most successful in getting good coverage of vaccination based this not at all on getting their citizens to try and understand the science. One is Bhutan, where they were very successful in preparing a campaign and involved. They asked, they were sensitive to the country's needs, to the citizens' needs, involved in informing the religious establishment, and in fact using them in finding the right time and date. And they got fantastic coverage. No science was explained. The other example I know of is Portugal, where the campaign was handed to a retired army general. And the army general just treated the country as his troops, and he rallied the troops. He declared it as a war that the country, in patriotic passion, was going to fight together. And they had up there, I think they were leading in Europe, if not the world. The trouble is that many citizens don't understand uncertainty as part of the scientific method. And if I say today, this is my best belief with that uncertainty, and somebody else says tomorrow, you didn't do that experiment right, you didn't, that's the way we are. So we've got to go so profoundly into educating citizens about the scientific method if we want better trust in science. And the bad news is, who's it going to be? It's not going to be us, because we're the ones who are mistrusted.
But let's expand this. It's such an important issue when it comes to this trust in science, and I want to address all the speakers here. If that's not up to you, who can do that better? And how can we make this more of an organized way to get better results at the end?
What you have to do, if you're really interested in communicating information that will motivate people to change their behavior, you have to take the approach of meeting them where they are, explaining it, and presenting the information in a way where they will adopt the desirable behavior and feel good about it. And maybe that was the secret sauce to what happened in Portugal and in Bhutan. Health communicators and scientists worked to communicate the risks and what we understand today. So when we speak in probability, we are going to lose our audience. So all of us have to begin to realize that we have to stop our professional scientific speak or engage others who can translate for us and meet people where they are. If we do that, it'll be the stepping stone of building trust.
The big problem was in places where vaccines were so effective that the diseases had disappeared. And then you can say, well, do I want to take this vaccine that has a side effect, or is it organic, or does it have this or that? And that was where we were. That was so interesting. What you didn't mention was the intentionality, the politicization of the process. There was also, attacks that were done. There were, bots in social media that were putting out misinformation on both sides. And lastly, and this is what's completely different, is today a rumor spreads literally at the speed of light.
Now let's go into what Michelle just mentioned. Let's talk a bit more about the health governance, because at the end of the day, this is the bigger picture that has so many elements into it. Nobody, I think, in this room can deny the importance of health governance, and yet it's not perfect. What are the next steps and elements needed to improve it as much as it is possible?
There has to be mindset shifting in what it means to engage in multilateral agreements around global health issues, and there has to be real improvements in the infrastructure and the finances and the workforce. And that's going to take leadership. And it's going to take a commitment to true multilateral engagement. And we have to have people who are committed to the exercise of global health diplomacy. And it's a science and an art, but it also has to be a commitment for all humanity. Because we know, and we knew this since 2014 with Ebola, that it only takes 8 hours for a threat from over there to be a threat here. And so we have to realize, not just in rhetoric, but in practice, the science is really important. I am a molecular biologist and an epidemiologist, but governance has to realize that they have been underfunding science in behavioral, understanding human behavior, and they have underinvested in the implementation of the scientific knowledge and the tools that we have. So we have to get to a level where governance is appreciating funding communities, funding regional health officers, equipping them with tools, and engaging in creating a safety net that goes from knowledge creation and creation of vaccines and therapeutics to explaining and motivating and cultivating that environment of trust for adopting behaviors that promote health for individuals, communities, families, and the world.
Yeah.
I'd go maybe beyond where Michelle is, because I agree with all that she said, but we also have to keep in mind there are limits to where the governance structure can go. And I think we have that practical experience now, because when we formed COVAX, we had to put in place 50-odd innovations, things like indemnification and liability, no-fault compensation. We had to work on, the export bans that existed, and some of them were very public of vaccines, but there was also materials that weren't being shared. And so one of the questions is, how far can we go with governance? And, Dr. Tedros and WHO is trying to come up with a pandemic treaty that will help us move some of these forward. But the question is, can you legislate all of it? And one of the things we learned is there were countries who were supporting us, giving us money, cheering us on, and then going to the countries that were producing the vaccines and buying them for themselves and using them. And at the end, a national government is supposed to protect its population, and that's its job. And when we said you're only safe if we're all safe, what we were talking about is, yes, protect your high-risk populations, but then protect other high-risk populations. And instead, many countries said, well, forget about others. We're just going to do our own. And then we saw these waves of disease, and people realized it is really a global commons.
Even though, as Seth said, this was kind of a world record of vaccine development timelines, I still believe we can do much better with a lot of things we've learned about also how we scale the companies. And so one of the things, for example, we're doing, I was just discussing with Richard Hatch at We Run CEPI before this meeting, is trying to get into the clinic all the 15 vaccine against the 15 high priority viruses defined by WHO and CEPI, to be able to get clinical data on those. Because if we had known the dose of our vaccine against the coronavirus in January 2020, we might have saved another 3 months. So think about the number of lives that could have been saved with the vaccine launch, in August versus, in December. And so we're trying to figure out a lot of things that we can do to just collaborate with academics around the world to open the Moderna platform.
What we need is those vaccines in vials, ready to go for the clinical trials, or doing as much testing as you can ahead of time. And the challenge with that is those vaccines are going to expire, and so it's a few $1 million. And so, the point here is we don't spend the money because we're worried about wasting those few $1 million for something that could, this pandemic has been probably a $12 to $15 trillion pandemic. We need in peacetime to make those investments.
And to build on Seth's point, what I worry about now is a lot of countries are forgetting. The pandemic is still ongoing, still, as we say, a lot of people are dying every day, but a lot of governments are moved to other things. And that's a problem because we need investments in public health infrastructure, in healthcare workers, in genomic surveillance. There's so many pieces that need to happen.
Maria, I would like to ask you about that specifically, on the need of that investment and the importance of not forgetting to have a better future pandemic preparedness, because, as you said, to be ready for whatever's coming next.
I think we did extremely well. We've heard it both from the logistic but also from the scientific side. The basic science was there, and it was science that had been funded for completely different reasons. So 2 of the European researchers whose work led to vaccines, Adrian Hill in Oxford and Uğur Şahin in Germany, had been funded by a funder, namely the ERC, for their fundamental science to do something different. And let's not even talk about Katalin Karikó, who'd been working on this for 20 years. So we did extremely well. It was right there. We've heard the logistics, the production, the underlying science happened in record time without needing a warp speed funding from above. That did well, but the science was there. So my plea is keep investing in the basic science. Let's not forget that. The next pandemic may be different. We don't even know. Nature can come up with anything. We're prepared in many ways, and I'm very glad to hear from all of my colleagues about the ways in which we are prepared and which we've learned. The production, great. We've done the basic molecular biology, epidemiology, production, etc. I loved what Michelle said, understanding behavior. So a completely different aspect of understanding and research we need. I'm very glad to say that the ERC funds that kind of research. And it's a really privilege to work for a funding entity that recognizes the need to fund the humanities and the social sciences. That, I think, needs a push, and I'm glad you brought it up. I would say that. We have learned, because we need all the other aspects that my colleagues have said and that are obviously recognizable, I want to say don't restrict funding to the fundamental sciences in their full breadth. You'll never know what we'll need for the next outbreak.